So what is a diabetic footwear? Basically, many people have the misconception that it will help them lower their sugar levels, or it will help them increase their blood flow, or it will help the neuropathy to becoming better and the sensation will come back. These things are not true. So basically what a diabetic footwear does is, in neuropathy there are multiple different types of problems which occur in the foot, and the diabetic footwear will help you in stopping or preventing issues caused by neuropathy, but not neuropathy itself. So what are the basic functions of a diabetic footwear? In neuropathy, there are three basic types of issues that occur in the foot, that is autonomous neuropathy, sensory neuropathy, and motor neuropathy. In autonomous neuropathy, basically the function of your blood flow and the sweating is done by autonomous nerves, which gets affected due to neuropathy, and the sweat glands stop working properly, the sweating reduces, and also the vascular functions reduce, so the blood flow is affected, because of which a healthy skin will become a dry skin, and the dry skin will cause calluses, corns, and sometimes ulcers. In our footwear, we use a material which will cause a little bit of sweating on the foot, which will keep the foot moisturized, and it covers the entire foot. So it will retain the moisture in the foot, it will keep the foot moist, which will reduce the calluses, the corns, and also sometimes infection in your cracked foot. The second type of neuropathy is sensory neuropathy, in which what happens is your sensory nerves are affected, and they are the ones which are responsible for you to feel where you are standing, how you are standing. You also feel pain because of them, you feel touch because of them, and you feel temperature because of them. So the sense of all these things is gone first. Now you will say the pain is gone, what's wrong with that? But because of that pain is gone, you won't feel if you have a wound or no, if you're bleeding out or no. All these things which help you understand that you have some kind of pain are gone. Because of which people sometimes walk on their ulcer, they keep on pressing it and the ulcer won't heal, because it's a wound which is getting damaged every day by just walking. So basically in footwear, we can't bring back the sensation, but what we can do is protect the foot better. What we do in this sole is basically, this sole at its thinnest is at least 1 inch thick. Now what happens, even if a 1 inch nail is inserted into this, it won't reach the top part and it won't puncture the foot. So the rubber we use on this sole is basically used in airplane tires. Now airplane tires are basically designed to not have punctures. So we use this for our patients so that their feet won't be punctured. The third type of neuropathy is your motor neuropathy. Now in motor neuropathy, what happens is basically the motor functions, which is the movement functions are there in your foot, those functions will get affected. What will happen is basically your feet will start getting cramps, and while walking you can see these types of patterns in the patients. And because motor neuropathy and sensory neuropathy occur at the same time in a diabetic patient, what happens is basically the diabetic patient will start falling because he can't control his muscles and he has lost the sense of standing straight. Doing balancing is a very difficult task, so what we do in our footwear is basically mold this footwear according to how a foot should be rather than how the foot is. So what we can do is, at least while walking in this footwear, the patient will walk straight and won't fall down. Now if you see the shape of this footwear, now what we have done is we have done extensive research into this and we have designed our own numbering system. Now if you see these side by side, this is the European foot and this is the Indian foot. The size difference is already very clear. This is just one size below this, but you can see the width of both these things also along with the shape of the footwear is different. Just like the size of the footwear, what we have done is we have also reduced the weight of the footwear so you can walk with ease. Now this insole is also specially made from a material which will absorb your excess pressure but not the rest of the pressure. What I mean is, so whenever you press this footwear horizontally, you will find that it is not pressing at all. But as soon as you use a nail, it will go straight in without any resistance. So whenever there is a high pressure on the foot, it will get absorbed into this insole, but only and only the high pressure. So whenever you are walking on the road, what happens is you stomp on the foot and this insole will absorb that pressure, and the absorbed pressure will be released as soon as you lift off, and that excess pressure will give you a bounce to your walk and you will walk faster, and also it will reduce the stress on your foot. Now the material we use for this footwear are all washable. All the materials of this footwear are washable and you can use soap to wash this footwear. This will keep your feet healthy and hygienic. So don't wait, contact this number and get yourself a customized diabetic footwear.